Assalamualaikum. I, Dr. Muhammad Akram, Department of Eastern Medicine, Government College, University, Faisalabad. I would like to discuss about vitamins. Vitamins are organic compounds required by the body in trace amount to perform specific cellular functions. Human body cannot synthesize vitamins except vitamin D, K, and some of the vitamins are B complex and therefore they must be supplied in the diet. Classification. Vitamins are classified into two main groups: vitamin A, D, E, and K. Only vitamin K has a coenzyme function. These enzymes are released, absorbed, and transported along with the fat of the diet. They are not readily excreted in urine. They are stored in significant amount in liver and adipose tissues. Vitamin A is also called retinol. Sources: animal sources, liver, kidney, cream, egg yolk, fish, colostrum, a form of milk produced in late pregnancy and few days after giving birth. It is thick, sticky, and yellowish. Is also very rich source in vitamin A. Plant source: carotene. Carotene, provitamin A, or yellow red pigment found especially in carrot, yellow corn, sweet potatoes, peaches, and spinach. They are antioxidant. Among carotene, beta carotenes are the most efficient precursors of vitamin A. Carotene do not have any vitamin A activity. They are converted to active vitamin A under the influence of thyroxine. Since thyroxine is required for the conversion of carotene to vitamin A, in thyroxine deficiency, hypothyroidism, carotene accumulates in the blood, resulting in conditions known as carotenemia. Besides hypothyroidism, conversion of carotene to active vitamin A is also decreased in diabetes mellitus. There are two situations in which vitamin A is decreased in the body. First is diabetes mellitus, and the second is hypothyroidism. In diabetes mellitus, conversion of carotene to vitamin A is deficient, and in hypothyroidism, it is it may be carotenemia because thyroxine is necessary for the conversion of carotene to vitamin A. Absorption and transport of vitamin A from intestine to the liver. Retinol esters present in the diet are hydrolyzed to free fatty acids and retinol, vitamin A. Carotenes in diet are cleaved and reduced to retinol. Intestine mucosa retinol is re-esterified to long-chain fatty acids. Vitamins. Water-soluble vitamins, ascorbic acid, and the vitamin B complex. Vitamin B complex includes energy releasing, hematopoietic, and others. Energy releasing, thiamine, vitamin B1, riboflavin, vitamin B2, niacin, vitamin B3, biotin, and pantothenic acid. Hematopoietic, folic acid, and cyanocobalamin. Others, pyridoxine, pyridoxal, and pyridoxamines. Fat soluble vitamins: vitamin A, retinol, vitamin D, cholecalciferol, vitamin E, tocopherol, vitamin K, minoquinone. The vitamin A. This esterified vitamin A is absorbed by the intestine and released into the lymphatic as a component of chylomicron. Retinol esters present in the chylomicron are taken up and stored in the liver. From liver to the target cells, when body needs, liver releases retinol. Retinol attaches to the plasma retinol binding proteins. This retinol binding proteins complex is transported to the extrahepatic tissues. Retinol RBP complex which attaches to the specific receptors on the surface of the target cells. Inside the cell, retinol binds with cellular RBP. This cellular retinol RBP complex is carried to the sites in the nucleus where the vitamin acts in a manner analogous to steroid hormone. Functions of vitamin A. Vitamin A performs various functions: maintenance of visual cycle and epithelial cells, reproductions, growth, metabolic rate, and prevention of chronic diseases. Retinol, the aldehyde form of retinol performs all the functions of vitamin A. Retinoic acid, the oxidized form of retinol, performs the functions of growth and maintenance of epithelial tissues. Visual cycle. Vitamin A is a component of visual pigment, rhodopsin, commonly known as visual purpur, of rods and cone cells of retina. Rhodopsin consists of 11 cis retinol, specifically bound to the protein known as opsin. Rhodopsin is essential for vision in dim light. When eyes are exposed to bright light, all of the rhodopsin gets hydrolyzed, and when the person comes back in the dark room, he will be unable to see in the dark for a while. In the dark room or dim light, resynthesis of rhodopsin takes place, and after some time, the person begins to see in the dim light. The time required for resynthesis of rhodopsin depends upon the intensity of light thrown in eyes and the availability of vitamin A. If vitamin A is deficient, synthesis of rhodopsin cannot take place and the person becomes unable to see in the dim light. That is the night blindness. Reproductions. Retinol and retinol both are essential for normal reproduction. They support spermatogenesis in males, prevent fetal loss in females. Retinoic acid is inactive in maintaining normal reproductions and visual cycle. Animal given vitamin A only as retinoic acid from birth will be blind and sterile. Growth. Vitamin A is essential for the normal growth of bones. Animals deprived of vitamin A initially lose their appetite and anorexia, possibly because of keratinizations of taste buds. Bone growth is slow and fails to keep pace with the growth of the nervous system, leading to CNS damage. Thank you very much.